Welcome to ICL Surgery, Hyderabad. We are a team of ophthalmologists who have come together in order to standardize the surgery and the process for implantable Collamer lenses surgeries in the city of Hyderabad. Me and my colleagues, we cover the entire city of Hyderabad from various geographical regions. What is ICL surgery? ICL surgery is, simply put, a way to remove your glasses. So ICL stands for Implantable Collamer Lenses, which are very thin lenses which can be placed in the naturally occurring space in the eye without any additional space creation or any replacement. So for instance, if you look at cataract surgery, we remove the natural lens and place an artificial lens in that place. Whereas in ICL surgery, we don't remove the natural lens, we leave the natural lens in situ and place another very thin contact lens on top of those natural lens. When would I get ICL surgery? So, as all of you would know, in order to remove the glasses, there are few options available. First is, you can go for a normal contact lens that you normally wear every day and remove it in the evening. Second is where you can go for a laser surgery. Now, laser surgery is something which is not suitable for all patients alike. Every patient might not be suitable candidate for a laser surgery. So in those kind of patients, an ICL surgery becomes a very good option. What are the types of ICL surgery? ICL surgery is essentially classified into toric and non-toric ICLs. So what is a toric ICL? Toric ICL is a term used for those ICL lenses which correct the cylindrical aspect also in addition to the spherical aspect. The surgery, time, evaluation, everything and the surgeon's work to it nearly remains the same for you. But for the surgeon, putting a toric ICL is slightly more challenging. Calculating the lens power is slightly more challenging. So these are the two different types of ICL surgery available widely now. However, there is a new ICL which is in the pipeline available at very limited places in which it also corrects near vision targeted for people who are above the age of 40. Is ICL surgery permanent? Now, let us see what do you mean by permanent? If you are talking about whether the vision correction will remain so permanently, yes, it will remain so permanently, it will not change. But are you asking in terms of whether it can be removed? Then it is not permanent. So, ICL surgery is a permanent but reversible procedure for spectacle correction. That gives you a lot of safety margin, it gives you a lot of flexibility in terms of future corrections. Are there risks to ICL surgery? Yes, there are risks to any surgery per se. Any surgery has got its own inherent risk of being a surgery in the first place. Secondly, ICL, the risk is when the surgical technique is not correct, the calculation is slightly off, or those kind of errors. So, apart from the standard surgical risk, ICL surgery does not pose any additional risk factor for itself. Benefits of implantable Collamer lenses. Implantable Collamer lenses are a set of lenses which are very thin, very flexible, and it can be placed in the eye in front of your natural occurring spaces without disturbing your existing eye tissues. We don't modify anything which is there. So we just slide it in. The ICL generally doesn't touch anywhere. It will just float around and will work permanently to manage the correction of your eye. Is ICL surgery safer than LASIK? This is a slightly difficult question to answer because in the right hands, even a LASIK is fantastically safe. I'm not saying that LASIK is bad. LASIK is good. But given the option that you can reverse the surgery in case of an ICL, while in case of LASIK, you cannot reverse it. That gives me a slight jitters. Other than that, in a good surgeon's hands, a LASIK is fantastically safe. There are millions of LASIK being done across the globe year on year. So LASIK is a safe surgery, but ICL gives a slightly better edge than LASIK. Can you rub your eyes after the ICL surgery? actually speaking, you are not supposed to vigorously rub your eye anytime, whether after or before the ICL surgery. But anyway, even if you rub your eye accidentally uh, after having an ICL surgery, there are no adverse effects that we expect to happen. Nothing will happen. Go ahead, a mild rubbing might not hurt, but yes, a vigorous rubbing will hurt any eye, whether it is with ICL or without ICL. Is Vision ICL safe? So, in order to answer this question, there's a particular word which is the Vision ICL. Now, ICL is a technology which has been in research for the specific material that is used to make ICL. There's a company by the name Star Surgicals who are patent holders in this particular material. They are the flag bearers of this technology, and their ICL model is called as Vision ICL. It's one of the most trusted, FDA approved and widely used implantable Collamer lenses, that is the phakic IOL, across the globe, with fantastic results and a very huge safety track record, which we would rely on in case of any implant. So Vision ICL is a very safe product to use, and as of now, we have not got any adverse reports in terms of the quality control issues. Procedure for ICL surgery. So procedure for ICL surgery has got three parts. Firstly, assess whether you as a patient is suitable for an ICL surgery or not. This is done by a lot of assessment, corneal topography, general examination of your eye, which an eye doctor would be able to do. And he will first decide whether your eye is healthy enough to undertake the surgery. Then comes the second part. The second part is the calculation of the lens power to be placed inside the eye to give you spectacle-free vision. In order to do this, we do a lot of corneal scans, eye length measurements, white to white ratios. A lot of mathematics goes into it. There's a complex formula which we use, and then finally we arrive at a lens power. Once we arrive at the lens power, we place the order for the lens. Once the lens is delivered safely to our premises, then we plan for a day for your surgery. So now comes the third part, the surgery itself. The surgery is a daycare procedure. That is, you can come in the morning, get yourself operated, go home in the afternoon. A lot of surgeons prefer to do both the eyes at the same day. Some surgeons prefer to do both the eyes on 2 different days. It's an individual choice depending on the experience of the surgeon and his confidence levels. Now, in case of the surgery in itself takes around 10 to 15 minutes, maybe 20 minutes, but generally not more than 25-30 minutes. Immediately after surgery, you will be able to see fine. The vision might have a bit of a blurriness on the first day. By the second or third day, you would see accidentally fell. So after the surgery, you will be given some eye drops which you might have to use for quite some duration. When I say duration, it might be 2 weeks, 3 weeks, depending on your operating surgeon. Now, after the surgery of both eyes are done, your medicines are over in around a month or 2, you can live your life just like normal without even thinking about that you have an ICL in your eye. Is ICL surgery painful? As like any surgery in any part of the body, is a job of a surgeon and the anesthetist to make your surgery a painless experience without any pain. In an ICL surgery, it's the same case. We would always give you adequate anesthesia using eye drops so that you don't feel a thing. Just sit back, enjoy 15-20 minutes of it, you'll be out in no time. Which eye problems can be treated with ICL? ICL has got an FDA approval for treatment of high myopias and astigmatisms. When I say astigmatisms, when you look at your glasses prescription, the first part of the glasses prescription is the spherical component which says whether you are myopic or hyperopic. If that part is in minus, then you're most likely a myopic. A myopic patient can undergo an ICL. Look at the part besides it, which mentions a cylinder and an axis. In those prescriptions, we can correct the cylindrical and axis power also using a toric IOL. So essentially, ICL is used to correct myopia with or without astigmatism. Does ICL cause dry eyes after the surgery? Understand that the ICL is placed inside the eye and dryness is an outside the eye phenomenon. We see in case of LASIK or any ocular surface procedures like pterygium surgeries, prolonged contact lens uses, the surface of the eye suffers, which is the main reason of having a dry eye. In ICL, what we do is we make a small incision on the side of the eye, which is too small to notice. And then we place the lens inside the eye, which doesn't affect the surface of the eye in any way. So the incidence of dry eyes with ICL is very negligible. Yes, I wouldn't say zero, but yes, it's very, very negligible when compared to all the other eye procedures. Can colored contact lenses be worn after ICL surgery? So, what are you trying to do with colored contact lenses? You are trying to have a different color on your iris. You want the center of the iris part to look with a different color. In ICL surgery, the lens is placed behind the iris, so the iris is visible in full, firstly. Secondly, a colored contact lens is placed outside the eye, so it doesn't affect the ICL at all. During night time, does ICL surgery cause halo light related side effect that is strongly associated with LASIK? In LASIK, we use excimer laser to alter and burn off a part of your cornea, which can lead to some haze developing in the cornea, which is one of the biggest reasons for colored halos happening at night in few cases. However, in the case of ICL, we are not modifying any existing tissues in the eye. So the chances of having a glare or a halo in bright light is very minimal when compared to a LASIK or a PRK. What is the lifespan of ICL? ICL, as you know, is something called as an implantable Collamer lenses. This Collamer material is a form of plastic. The lifespan of an ICL inside the eye is more than the life of the human being. So you don't need to worry about it. There's no wear and tear, there's no movements in the eye on the ICL which causes it to get damaged. So it's very unlikely that you will have to replace the ICL unless and until you develop a cataract or you are undergoing an ocular surgery. Besides these factors, there is unlikely that you will have to replace your ICL in your eye, and it will be lifelong. How do I prepare for ICL surgery? It's very difficult to explain to you how to prepare for an ICL surgery over a single monologuing video. So what you need to do is just contact the number given on our website. You will be guided to a qualified person who will ask you a few questions and assess whether you are suitable candidate for an ICL surgery. And accordingly, you will be advised on how to prepare. If my vision is still not corrected, can I have ICL surgery again? See, in terms of ICL surgeries, let's have something very clear. The calculation of the lens power plays a huge role in ICL surgery for its accuracy. It is quite possible, it's very possible, although not frequent, that you might have some residual refractive error. In those cases, we can have two options. Either we leave it at it if it is very negligible, or if it is significant, we can always remove the existing ICL and replace it with the correct one. It can always be done. That's the beauty of ICL being reversible surgery. Does health insurance cover my ICL surgery? This is a question that we are faced with every day. So, most of the insurance companies, health insurance companies, they cover ICL surgery to a large extent. However, it comes with its own terms and conditions, because on an outset, when you look at your eye, you are able to see with glasses. Do you need the ICL surgery? It's not mandatory. That's if you choose so. The healthcare insurances also look at it in the same way. So only if your prescription power is higher than a certain value, then your health insurance company will cover your ICL surgery in health insurance. For more information, you need to look at your terms and conditions when you bought the health insurance policy. As far as the hospital is concerned, we would try a level-based to get your due from the health insurance, but however, we do not assure you that it is always covered under health insurance. Feel free to contact the given number on our website for any queries, any clarifications, or any doubts regarding ICL surgery at any time. Thank you and have a nice day.